Good morning, learners. We have been dealing with some of the issues of lifespan development, and we dealt with infancy and childhood, and today we'll be dealing with puberty and adolescence. Puberty is the stage from the period of say 8 to 13 years or so, where there are growth changes occurring. It is the end of childhood and the beginning of adolescence. The short period which overlaps these two, that is the end of childhood and the beginning of the adolescence, is known as the puberty. We see here that there are a number of changes occurring in the children. That is, we find that there is hormonal activity and also there is reproductive organs develop. And we see that the central nervous system takes part in all these. It produces the hormones which make all the organs grow in the body. And we see that there are several changes in body as well as the mental status. That is, we find a gradual development of the child from the childhood stage to the adolescent stage. Now we see that this particular growth of every human being is programmed into their genes. So the whole development is actually written in the code in the genes. So therefore, we find that the children develop and grow into adults. And this phase of developing from childhood to adolescence is also dependent on the hormones, that is the growth hormones, which are produced in large numbers during the puberty period. We see that during puberty, which generally, as I say, occur during 8 to 13, which may extend to certain extent to 15 to 16 years in some late cases. These years, especially from 8 to 13 years, is the stage where we see radical growth in the child, that is in terms of body proportion, size, weight, development of reproductive organs and other things. So here, this is because the pituitary gland, which is there in the hypothalamus region in the brain, is the hypothalamus. The gland present in the hypothalamus start producing a number of hormones, especially the growth hormone, which has an effect on all the other hormones or all the other hormonal glands in the body. Now, the onset of puberty again gives rise to a number of changes, and we also see that there is more cognitive development of more social skills, and also there is a number of motor development, and the body proportions also increase. Now, there are certain characteristics of puberty. For example, we see that the puberty is a very short period and it sometimes overlaps. That is, from childhood to adolescence, we find it, as I was saying earlier, from 8 to 13 years, it may overlap over a certain period. And we find sometimes some of the children may mature very quickly, and sometimes some children take time to mature. That is, this physical development aspect is dependent on the growth hormones, which is again dependent on the genes. So we see differences in different children, which brings about different spurt or growth spurt in the children. Now, puberty is divided into different stages. That is, we can have 3 stages. One is prepubescent, pubescent, and postpubescent. So, this prepubescent includes the first evidence of sexual maturation, where we see that the primary sexual characteristics like hair, pubic hair, and the first emission of semen in the male children can be seen. And we find that the menarche, that is the period before the ovulation starts, is also seen in females, which results in the regular menstrual cycle. Puberty is also a time of rapid growth and change. we see that it lasts for a couple of years where the children become sexually mature. And after a few months of adjustment, that is 6 months to 1 year, they gradually find that the increased growth patterns are seen and the change becomes a sort of a permanent feature. Puberty is also a sort of a negative phase. According to Charles Buehler, he says this is a negative phase because they take an anti-attitude, or they try to see, they try to lose some of the good qualities they are formed earlier. That is, they're trying to be more individualistic. So here we see that the negative phase is where the individual becomes somewhat different in his characteristics or behaviors. And this is because he's becoming sexually mature. And this behavior of negative phase of puberty is pronounced more in girls than in boys. Now, puberty also occurs at a variable age. It is not that the puberty occurs at the same age in all the children. The puberty varies from 1 to 2 years in girls. So sometimes you see that these girls grow up faster than the boys, but at the same time, variation is seen among the children. Now, some of the concerns of puberty is, here the children find themselves very confused, and they are mostly critical of the issues around them, and they're complaining, and they show more resistance and also delay in doing things and argue a lot. And this is because this stage is leading them to the adolescent stage, where they become emotionally more complex. Now, we also see that there are certain physical and physiological changes associated with puberty. This is due to this thing that they have to adjust to the fact that the body changes. They have to become adjusted to their own body images. And they also find they have a self-concept developing. The children find it difficult to accept their own bodies as well as the socially approved sex roles. And they have a sort of difficulty in understanding their own sexual maturity. So we find that there are some aspects where the children also develop a leadership quality and also try to have higher self-esteem. But more often we find that the hostility or most depressive sort of feelings also develop in the children, where they also develop certain deviant behaviors. For girls, this sort of maturation also brings some physical as well as physiological changes. They find themselves taller and heavier. When some girls are taller and heavier than the others, they try to compare themselves with others, and they find themselves also seeing that they are deviant from others. So we find sometimes that the more maturing boys are usually, they are patronized, they're liked well, whereas the girls who, and they actually form a sort of leadership role, whereas the girls who mature a bit faster, they are also treated differently in the society. So the timing of puberty also has a big role on the emotional well-being of the person. Sometimes if the timing is not appropriate, if it is late or slow, there is some sort of confusion among the teenagers with regard to their maturity as well as sexual roles, as well as how they fare themselves in the society, as well as their own feelings of self-esteem. We find in these stages, the children experience a new sort of social experiences. They find themselves being treated differently because they are at the crossroads. They are neither children nor adults, and therefore they are being treated differently. And knowing this fact, they find they are at the bad end of both the feelings. That is, they are neither completely adults nor at the same time they have the characteristics of the children. And with growth and maturity, some of the boys experience popularity, while the slowly maturing boys experience some sort of what you call a decline in popularity. So we also find that new emotional experiences are seen, and the adolescents or the stage, the children where they're in the puberty stage, they experience raging emotions. That is, their body produces certain chemicals which can affect their mood. And we find these fluctuating hormone levels can have cause increased moodiness and sometimes it also has an effect on how they behave with their parents or elders or with other friends. We find they have some sort of insecurity within themselves. So the self-esteem is also at a critical stage, depending on the encouragement they receive or understanding they receive. We sometimes find that their self-esteem remains good or better, while people who are not actually having any sort of support systems find that their growth as well as their physical changes can actually can be demotivating for them, and they go on self-examining themselves and they may feel miserable, but it takes them time to actually seek attention. At the same time, they have to come to terms with their own growth, and this will take some support from the elders or the parents. Now, for most people, puberty catches them at a bad time, that is from 9 to 13, that is when they are separating from the shelter of childhood, as well as trying to find their place in the society as adolescents. So here they feel they are out of control because they find new things happening in their body, new growth spurts happening. Now, this growth spurt is because of the pituitary gland. The gland influences the other hormones, and we find that the gonadotropins are produced in the bloodstream, and we find that they increase development in the gonads of the reproductive organs. And in the males, the hormones that are produced are known as androgens, and in the female, the hormones produced are known as the estrogens. Now, heredity is one of the factors which actually helps in the growth aspect, because the genes by themselves, which are the characteristics of the which are characteristic features, they try to develop, they have a clear link in producing the hormones, and depending on the hormone activity and other factors, environmental factors like the nutritious food one gets, as well as the care one is taken, and all the other factors. Now we find that both the growth as well as environmental factors as well as genetic factors have an increasing role, or they have a clear role in trying to establish how a person quickly or matures slowly. Now we find that this hormone actually help in depending on what sort of environment you grow in, they have a feeling. For example, depending if the food they take in is polluted, it also happens their hormonal levels also gets affected. That's why we find nowadays that the girls mature quickly, because the milk or whatever they take in may be contaminated or may be polluted with hormones, which that is the cows may be given certain hormones which are estrogen-like hormones, which can have a quick effect, or they can have an effect on the growth of the girl child. Now, therefore, we can say that the pollution can have a clear effect on the growth of the children too. We find nowadays quick maturation occurring. Generally, the girls, the growth spurt occurs somewhere between 8.5 to 11.5 years, and whereas generally at the average of 12.5 years, with as I was talking about, with pollution nowadays, the girls tend to mature quicker. And in the boys, the growth phase is seen somewhere between say 10.5 to 14.5 years. So later, after a growth phase, we find that the growth generally tends to decline when one is 20 or 21 years. So generally in the girls, the growth is seen earlier compared to boys, and we find that the increases in height, weight, and strength, all these characteristics are seen. Now, poor nutrition can also have an effect. If the nutrition is not good, it will result in somewhat a stunted body, whereas if the nutrition is good, it can result in a healthy body. Now, we also can talk about certain emotional disturbances, which can also have a negative effect on the growth. Further, we also see that the delayed fusion of bones or skeleton can also have an impact, and depending on the types of infections one is prone to, or the causes of illness, or depending on other emotional tensions, we find sometimes the growth can be slow. We find that there are several changes in body at puberty. We find that the changes occur in the body proportion, development of primary sexual characteristics and development of secondary sexual characteristics. Now, generally, starting among the girls, that is, in the girls, the average increase in height is about 3 inches at the stage of menarche. There is a gradual rate of growth, which comes actually to a standstill in girls around 18 years. Now, for boys, the growth starts at 13 years, where there is clear growth in the height, and it ends at somewhere at 20 or 21, where the growth completely stops. Now, the weight is also weight of a person grows during this puberty. And this is because of the increase in the fat tissue as well as the bone and muscle tissue. And this weight gain is seen especially during the menarche in the girl child, where there is fat deposition in the body. Fat is also seen deposited in the boys, but it is somewhat less. The fat actually disappears after puberty, that is after maturing. Now, we also see at this stage, the body proportions or the skeletal changes are augmented, and the cartilage calcifies a lot. The finer or the smooth or softer cartilage now becomes hardened, and there also certain cartilage calcification is seen, that is calcium deposits, and it becomes a clear bones, and boys develop broader shoulders, straighter hips, and long forearms and legs. Whereas the girls try to develop the fat around thighs, hips, and buttocks. Now, these changes are dependent, we see clear differences between the girls and the boys regarding the weight and strength. We also see that there is development of primary and secondary sex characteristics. The primary sex characteristics are the development of the sex organs themselves, that is uterus, vagina in the females, and penis and testis in the males. Now, these secondary sexual characteristics help in the changes in the body shape and also body height. So along with these changes in the gonads and body height, we say that the sexual maturation has occurred. The primary characteristics are also seen accompanied by the secondary sexual characteristics. The secondary sexual characteristics that are seen in the females are the enlarged breasts and hips, whereas facial hair and voice change, where we can see deeper voices in boys. We also find that the sweat glands also increase in both sexes. With the onset of menarche in girls, we see that the ovulation process starts, and smear mark or the ejaculation of sperm is also seen in the males, where it starts around the age of 12. It is seen generally between the age of 12 to 60. Now, these differences or these changes can happen in months or weeks, and the onset of the menstrual period may start in the girls, and this primary sex change in girls can result in what we call the loss of blood and first lining of tissue, and also this initial shedding of the blood scales along with the what we call the ovum is seen. And here, this is a procedure actually by which the body prepares for the fertilized egg to attach itself to the uterine. So the shedding of every month, the blood and the vaginal lining is a preparation actually for the egg to launch itself to the fallopian tube if there is fertilization. So the lining is shed every month when the body realizes it is not pregnant. We find that on average, the first menstrual period when it occurs may vary between ages. In some girls, we find it is seen quickly. In some, it is seen at the age of 15 or 16. So first menstrual periods can be somewhat embarrassing to girls and uncomfortable. Now, the secondary sex characteristics are, we find that with the increase in the growth spurt, that individuals also develop certain secondary characteristics like having the body hair or facial hair. And also the legs and arms start growing at a fast rate. And there's an increase in the body buildup. We find that more muscles are grown. We find that the youth or the boys become more interested in trying to groom themselves, that is their facial hair. And also that we see an increase in the body fat in the girl child, as well as the increase in the widening of the pelvic bones. Now, breasts are also growing, and we find sometimes they are not of the exact shape or size, but gradually they try to be somewhat that the breast symmetry may develop later. So, but in spite of, if there are certain differences, or if such differences exist in the symmetry, then a family should consult the family physician. So we find in the boys that the voice changes, the larynx or the voice box grows larger, and the voice cords become stronger. And we find that the boys have a cracking voice now, and they find themselves voices annoying or somewhat daunting, and they try to see, they take care to see that they do not speak much, but through parental guidance or through thoughtful listening to them, the youth tries to adjust itself to this new sort of changes that are occurring in their bodies. So we can say at summary that the puberty is a stage of differences where the body matures in both the girls and boys, and it is an end of childhood and a launching into adolescence. We find certain physical and physiological changes occur in the body. We find that the growth state and the development of primary and secondary sexual characteristics are seen. The youth find themselves somewhat discomfort with growing body proportions, as well as the way they are being treated or looked on by their relatively by their parents or by their companions, and they find themselves a bit difficult to adjust to their own body images. And we see that the size, shape, and the weight gains are seen, and this actually is a stage where the body or the human is trying to develop into a full-fledged body which has the capabilities of reproduction, as well as the mental and the cognitive abilities also gradually develop. Now we'll try to deal with adolescence. Now puberty is a change of physical aspects, and adolescence is the same thing, but puberty is a small stage where the quick growth of the reproductive organs and there are changes in bodily changes, whereas the adolescence is a stage where along with these changes, there are certain changes seen in the social and emotional conditioning of the child. Now we find that adolescence start somewhere immediately after puberty, and it goes on for a longer period, say from the age of say 13 or 12 to 13 to say 18 to 21. Generally, it is up till 18 to 19. In some stages, we find certain growth or developmental aspects may tend to stretch over to 20 to 20 years. Now, adolescence is an important period of change. Here we find that the physical changes like the growth spurt or whatever we have seen initially in the puberty tend to go on maturing, and the changes in the organs is directly related to the reproduction ability, and the secondary characteristics are still being developed, and the adolescent thinking is now that of at a greater level. Now they have a sophisticated way of thinking, and from the stages in the childhood where they have the children are able to not only understand the concrete things or which is present from their present in front of their eyes, the thinking now becomes more logical and also more abstract. Now they also try to test hypotheses, try to experiment on their surroundings, and go on a trial and error basis. They try to experiment with various facets, and they find infinite possibilities. The adolescents also express some sort of egocentric behavior where they find that they are the center of the world. So this is a confusing stage where they find that the others have to listen to them, and at the same time they feel that others are not listening to them properly, their viewpoints. At the same time they also feel that they are the center of the world. So this is a conflicting stage for them, and we find that the role determination by the society also is, and their families actually helps the adolescents to chart out their own courses. For example, the identity, they have this search for identity, they want to find out who they are. and they try to struggle for independence. And also we find that the biological functioning, their understanding levels, and the social environment can also, the interpersonal relationships can have a bearing on how healthy an adolescent can be. This is the time where self-conception is seen. We find generally that the adolescent stage is a problematic stage because they find themselves that there are large social changes, and here they try to interact mostly, the adolescents try to interact mostly with their peers or the persons from the same age group, and they try to spend less time with parents. Adolescents also have various pressures on them. They find that they're increasingly stressed. They want to have a sort of recognition with their peers and their community level or school level and at family level, and they have a difficulty in expressing themselves. It is also a stage of unrealism where the adolescents are increasingly involved in risky behaviors so as to make an impact on others. So it's also a stage of vulnerability. We find that the views of wisdom of adults are not taken into consideration, but the adolescents feel that they have their own feelings, and they also sometimes we find they're vulnerable to a point of helplessness. So in such a stage, it is also possible to actually try to mislead them. They have their own perceptions developing. Sometimes if it is positive, an adolescent stage can actually help for more mature thinking, but sometimes if they are led astray, it can have a negative impact on their health and viability. So although adolescence is a gradual stage from which a child develops from childhood to adulthood, this is an important fact in the sense it tries to make a complete turn from the child, and it can have both the positive, positively groomed, it can result in a healthy individuals. And if there are negative consequences or if there are negative effects, the child may have a disrupted childhood or adulthood. That is, they may not be very healthy individuals. Now, adolescence is a transitional period. We find that this transition or instability, the phase through which they pass through, can also mean that they have to make major adjustments. They have to learn to cope with stress. They have to learn to cope with the new experience that they are facing. So we find that the life transition starts here. We find this is a stage where physical, cognitive, mental, emotional maturity occurs. And there are multiple transitions with regard to education, their training, or how they try to develop social relationships, etc. So here we find that the economic, social, and cultural factors such as the education and financial commitments, and all these can have a bearing, and depending on the background that the children hails from, that is whether it is from a lower class, middle class, or a middle class, or from richer background, they tend to have the transition is somewhat painful sometimes. Sometimes it is somewhat less painful. So this is a phase which is actually located between two transitions, the end of childhood and the beginning of the adulthood. We find that the physical and psychological development that we see during these stages can also is because of certain things like growing of arms, legs, and facial configurations. We find that in men, the chin actually grows and the nose also grows in size and in length, and the fat develops, and there are softening of contours in the body. We also find that the development of body hair, pubic hair, auxiliary hair, and in the men or males, we find the growth of facial hair. So we find that the small spurt of shadow like mustache can gradually grow, and we find that the hair grows on the chin, jawline, and the whole body, and also the chest. Now here, these changes become coarser, and we find also the development of more sebaceous glands. The glands are more active, producing oily secretions, which actually causes somewhat acne or blackheads in the females. Sometimes we find udder in the males because of these sweat glands. So we find that the basal metabolic rate, that is with which a resting person can consume oxygen, which is more, the basal metabolic rate is more in the children, that is quicker metabolism occurs, that becomes slower, and at a steady rate, the oxygen is taken in, and the pulse rate also gradually decreases. So we find an increase in blood pressure and a decrease in the pulse rate. We find that the psychological development of at this stage is due to the fact that the adolescents try to chart their course in the society, and here we find between 11 to 13 the physiological changes occur, and the adolescents try to loosen their ties with their immediate parents or their immediate families, that is parents or their siblings, and they try to relate more with their friends. And they also have a growth in the emotional and intellectual capabilities, and they try to relate with their peers much than their own family members. And also here we find that they try to interact with the opposite sex. The way they try to relate with their own siblings or parents is lessened, and they try to interact with the members of the opposite sex increases. And we find that the adolescent tries to battle along with his own sets of values, and that with compared to with those of the values that are given by their parents or societally set norms. So this is a stage of confrontation for them, where they try to establish their own identity, come to have a set of values which they try to own, and they also try to develop a self independence, a sort of independence and self-dependence. They also try to have a sense of responsibility, and they try to contribute to society. This is the stage where they try to have an initial stepping into the society, trying to contribute to the society and developing the altruistic feelings or trying to help others. Now, how a balance is, they live in a fantasy world, but at the same time, how quickly they are able to balance their fantasies to realities, and also try to understand the aspirations, their own aspirations, as well as the parental aspirations, and understand their own realities. And this balance of finding themselves and trying to balance the different, their own inner feelings with that of the outer world, this actually is in at this stage. And from the earlier childhood feelings of only trying to gratify the self, they also try to help the others and also look for others, what you call recognition, and their and also get a reward, a feeling of reward by actually helping the others. So we can say here they are able to, they are trying to position themselves in society, trying to find a role for themselves. We also find beyond this physical and psychological developmental stages, we find that the changes are also seen in the way they develop their morality. The moral development depends on the cognitive development of the children. We find that helping others, caring for others, and volunteering for social works, this is all dependent on the ability to understand. They develop their own personal values. They have their own judgment. They initially try to, what you call, follow in the footsteps of their parents, but gradually they start developing their own moral values through analytical thought, reflection, and by introspection, that is sitting and thinking about about values. And based on their intellectual and moral development, they develop an idealistic perspective, and they think that things should be fair. When we consider about moral development, we have to recall the Kohlberg's theory, where he says the young adolescents start to actually, initially they have this following their own parents, and then trying to say that they try to reciprocate what others say, but gradually in the adolescent stage, they try to understand people, and from their own egocentricity, they start stepping out, and they start caring about the people whom they try to respect. And here the self-centered perspective about their own rights as well as feeling of others comes, and the moral dilemmas which the children or the adolescents face at this stage are generally they pass through a stage, and here the adolescents feel that the justice should be served, whereas the females feel that the interpersonal relationships actually matter more. So the morality is based on the sense of justice at this stage in the adolescent male children. Now, actually, the reasoning of how a moral behavior should be, how moral behavior is seen, or the way that the adolescents try to justify their behaviors is seen when a person grows from child to adulthood. The way that they try to justify themselves based on the societal rules, mores, or democratic principles will gradually shift. And we see that the stage of a development determines actually the type of moral values one possesses. So we find this is a stage in adolescence where the moral dilemmas are seen. What is wrong? What is not wrong? What is correct? These things are actually being processed in the adolescent minds, and they feel that the social justice is a stage where they have to form. That is, before being adults, where they feel that the democratic principles or there are highest ultimate values of morality should be seen from a personal perspective. Here it is seen at adolescent stage that justifying or the social justice is the one of the reasons in which they try to justify their moral values. The family relationships are one of the aspects which try to influence the adolescents. We find that the young adults or sometimes live with their parents, and some of them in some cultures try to leave their parents and start living independently. So here, the adolescent male, the father is the most important role figure. For the adolescent female, it is the mother who is the important role figure. And we find that in the multi-centered households, the adolescents typically obey their father. And with if there are, in certain societies, it is a female which actually heads the household. In such a society, subordination is less. Whereas in the male-dominated patriarchal families, we find that the male, that the father is the central role figure whom the child or the male child tries to emulate or copy. Now, during adolescence, the parent-adolescent conflicts are seen. We find sometimes that there are continuous conflicts, sometimes spontaneous conflicts over small things, day-to-day activities, where the adolescents start even quarreling about the clothes that one has to wear, and also sometimes about the important issues like what career one should plan. And so interestingly, all these spontaneous conflicts occur on a day-to-day basis. Sometimes they're also harrowing or distressing to parents rather than in adolescents. So adolescents hail from different backgrounds. Some may have the single parents, some may have foster parents, some may have dual parents, that is both parents. Sometimes they may have loss of a parent, and sometimes they're blended families, joint families. So depending on the type of families one has, we find that the familial relationships or interpersonal relationships and family attachment grows. And along with the cognitive development, we also find that the familial relationships also take a bonding, and the interpersonal relationships within a family actually they help the child to grow better, and they are a supporting facet. They are the supporting strength which the adolescent gets during this stage, critical stage. And we find that if the family's ties are stronger, the adolescent can fare better in the school and also have better engagement with other fellows or friends or peers, and he has fewer high risk behaviors, that he doesn't involve in risky behaviors which may hamper his well-being, which may actually help in his better growth. Now it seems if the parents are warm and involved, they are concerned, and they provide guidelines and limits on what not to do, we find that the appropriate development is seen. Then certain expectations are also given by parents, and the adolescent now tries to find by adhering to this, and this can be effective. The parents, if they can use persuasive measures or reasoning, or if they can explain the roles and discuss issues and also listen respectfully to the growing adolescent, there is a possibility that the adults also can be more responsive and try to reciprocate and also share their feelings, and this can actually help in the healthy growth of the adolescent. So it is generally seen that if the parenting is more active or involved, the children also do well in schools, and they also report less depression and anxiety. Sometimes they also show high self-reliance and self-esteem. Now, this self-reliance and self-esteem are indicative of the self-identity. They try to what we call have a feeling of their own worthiness, and this can also develop this sort of self-esteem can actually and high self-regard can help them to involve less in delinquent behaviors or in bad habits like drug abuse. Now, these cannot be seen in healthy individuals. So it is the parental support and societal support which actually helps the individuals to come over this critical phase. Now we see that the personality of the adolescent also changes. We find that the self-concept emerges here. Now, identity has two features. One is a self-concept, where a person has a belief about himself, about his own attributes, physical attributes sometimes, and also the roles and goals he has, and also his own interests, values, and beliefs. The whole thing is known as the self-concept. How he perceives himself physically, what roles and goals he feels he has in his life, and also how he tries to develop certain occupations or tries to develop certain values, interests, and beliefs. The whole set of these factors can result in a person's self-concept. Also, they have a self-esteem. That is how a person feels about his own worthiness. Now, these are two different concepts, because now we understand that the self-esteem is like how much we approve of our perceived selves. So specific self-esteem, the self-esteem can be of two types. One is generally how others feel about us, that is known as the global self-esteem, or specific self-esteem on how we feel about our own body or feelings, or how we about our personality. This is known as the specific self-esteem. Now, both the self-esteem as well as self-concept can result in identity. It is the phase in adolescence that the adolescents try to discover their own identity. Now, the identity development and self-esteem concepts which develop depend on the physical development actually. Sometimes the physical development can result in development of self-esteem, especially the comments by parents or society or peers can actually develop in the global self-esteem. The self-concept, that is how actually children tend to spend much time on their appearance or how they sound or behave and how they experiment with all these things, shows it is of course a positive sign, but if it is developmentally appropriate and the experimenting, it is good. But sometimes it may result in certain negative aspects, rarely. That is, some children may feel that their body sizes should be somewhat thin. In such cases, it may result in a negative aspect. As children get older, the physical, behavioral, and other external attributes are seen, which actually these aspects lead to a more the physical attributes are not given much importance, but more of their values, beliefs, and ideologies are given more importance. Now, we find this psychological development in adolescents is gradually seen. And sometimes we find that there are cross-cultural variations on how a person behaves in a society. For example, in the Western societies, we find that competition, individual initiative are encouraged. Whereas in Oriental societies or in Asian cultures like Japan, China, we find where the people try to live in communities and people cooperation with each other and how they get along with each other, and the dependency type of relationship they develop with each other. These are mostly commemorated. That is, the identities are linked with that of the group. The identity is not separate, and more of a cooperative nature of activities are encouraged here more than that of the competitiveness. So it is the cultural background which also has an influence on the adolescent development and the role that is attributed to adolescents. So the personal characteristics and the accomplishments in each society varies depending on the perceived notions of the adolescent roles that are ascribed by the society. That is, society actually gives a role to these persons about how adolescents should behave. So the distinction between the individualist culture seen in Westerns and the collectivistic culture seen in the Asian countries are they have an implications on the value systems that are given. And we see that the achievement motivation is more in the Western societies, and sometimes aggression and altruistic behaviors that is concern for others and moral development also vary depending on the cultural aspects, or the culture has a definite role to play on the type of self-concept an individual develops. Self-esteem, on the other hand, we see that the high self-esteem persons are those who recognize their own worth and can acknowledge their weaknesses sometimes and generally feel quite positive about themselves. That is, if the dwell on the perceived inadequacies more, then the child is said to be low self-esteem. That is, they feel inadequate with themselves, and they also sometimes feel that they are not in a good stage, or they can gradually worsen and they're relatively bad, then they have a poor self-esteem. Now, this self-perception or self-esteem is dependent on the relationships or the parental support one receives. Now, all these domains of self-worthiness, which can contribute to self-esteem, depend on the global self-esteem, that is how others perceive yourself and how you perceive yourself. So actually the self-esteem gradually becomes from global self-esteem to appraisal of self-esteem by oneself, or we call it as a specific self-esteem, gradually gains more importance. The quality of friendships one has and the what we call the romantic relationships one develops during this period can result in global self-esteem. That is, high self-esteem is seen in girls who have supportive relationship with friends, whereas in the males, the high self-esteem develops when they are able to influence the persons from opposite sex or develop romantic relationships. But gradually, we find that our home environment, our peers, our parents' interactions can result in the self-esteem. At the same time, this global self-esteem can result later after a period in the specific self-esteem, where a person tries to give importance to the values and self-worthiness and their aims and the roles one plays. So the self-concept is an important bearing on the psychological health of the student. Sometimes people get confused about their roles as well as their identity and self-worthiness, and this can actually help, can cause sometimes developmental issues. But this is a phase where transition must occur, and this transition can be successfully done with the help of the parents. Now we find that there are certain hazards that are seen during the adolescent period. Most of these are the physical hazards. We find that the adolescents can be risk-taking, and along with the risk-taking comes certain behaviors which can result in experimentation, drug abuse, and also violent behaviors. Sometimes we find that most of the accidents are caused caused by the most of the accident prone people are the adolescents. They are vulnerable road users. So we find sometimes drowning also seen. So the physical hazards are seen. We also find that they are get injured, that they also sometimes have mental health disorders. Sometimes the risky behavior may result in what we call substance abuse or drug use, as well as in getting involved in unwarranted behaviors, that is sexual experimentation, and also alcohol, drugs, and tobacco use. Now we know that the HIV and AIDS and other infectious diseases are also seen. Sometimes the diarrhea and lower respiratory tract infections are seen between the 10 to 12 years of age. Other diseases like meningitis also occur in adolescent children frequently. The early pregnancy and childbirth are also seen if they are not properly what we call given instructions, and we find that sometimes due to the sense of experimentation or their vulnerability, we find early pregnancy in women, in the girl child. Also, we see that the alcohol, drugs, and tobacco use is done on a scale so as to actually when they try to experiment, these use of these substances can cause health problems. We also find sometimes that the nutrition, when not properly provided, may result in certain deficiencies. So anemia, that is iron deficiency anemia, is found to be the second leading cause in adolescents, which may lead to years lost. That is, the anemic condition which may persist later may result in the early demise or early death. So here the nutrition is an important aspect. We find sometimes the adolescents are either obese or sometimes they have low body weight, which both the conditions are not good. And we find 1 in every 6 adolescents is overweight, which is a problem in some cases. And in some cases, we find that the adolescents do not have access to proper nutrition, which also can cause problems. The physical inactivity of the adolescents can also be a cause of the lack of exercise can also cause certain health issues. We find that the obesity is the resulting cause from physical inactivity. The psychological hazards at this age are, they have problems with their own identity, their own autonomy, their own sexuality, as well as their relationships. We find that the confidence or self-esteem issues about their own body and their own mental health can also give rise to many mental conditions. The adolescents with the mental health conditions are prone to depression. We find that depression is a stage where the individual has difficulty distinguishing between his own fantasy and reality. That is, he's no longer able to distinguish what is a real condition from that of the fantasy condition. So these are known as the psychotic disorders. And sometimes we find that the schizophrenia and schizoaffective disorders are seen, which may affect the thought processes of the individuals. Sometimes psychotic disorders may occur if there is substance abuse. Marijuana or any other products can have LSD. These drugs can also have a debilitating effect, and especially such consuming of drugs can have an effect on the long-term effects on the growth or as well as their development. Now, eating disorders are also seen at this stage. Also, social media has given prone to certain overhype over certain bodily heights, weights, and the way one perceives other. And therefore, the addiction to social media can also actually try to move them away from the social realities. So sometimes instead of trying to interact with peers, we find that the adolescents try to stay aloof and they try to live by themselves, either attached to the social media. And we find that the sleeping disorders, eating disorders, and sleeping patterns all take a downtrend, and there is lack of regular exercise. The interpersonal skills are lost, and the problem solving and managing the emotions healthily, or all these aspects get lost if not adequately taken care of. So adolescent is a stage where there is a continuous flux of growth as well as continuous change in the physical and psychological as well as health aspects. The challenges of adolescence also are related due to development. We find that there exist certain eating disorders. Sometimes less of eating may result in anorexia, and whereas eating more may result in bulimia. These are disorders where the anorexia is a condition which is dependent on their own body image, and sometimes it may also be genetically related, where the children feel that they have to stick to the socially acceptable sort of bodily size and shape, which may give them a sort of self-stability or self-control, and they take on to dieting, to strict dieting, which may have a negative effect on the body, and this may result in a disorder, and where because of the less nutrition in the body, they are susceptible to diseases and also mental disorders, and the body weight gradually drastically stops. Intervention, that is, such a disorder should be actually monitored by parents. They should take into consideration, talk to the children and say that the body image is only a concept. It is a healthy body which actually matters. So we find with eating disorders come the mood disorders, anxiety disorders, obsessive compulsive disorder, where they try to go on doing the same thing, and personality disorders are also seen. So sometimes with the anorexia comes other habits like alcoholism. Sometimes they tend to eat more, they try to gulp the food, sometimes they try to go for a binge sort of eating, and sometimes they try to actually fast a lot. And the bulimia is a condition where they eat intermittently and they try to actually vomit the food they have taken in. These are actually two sides of the same coin, not having enough nutrition, but taking the food and trying to actually expel the food. And this will actually result in what we call a sort of bodily malfunctioning body, where it has loss of nutrients, body is not able to withstand infections, and then it becomes weaker, and it results in the what we call gradual decline in the health status. We find that there are a broad range of appearances. The adolescent should be protected from all these sort of feelings about body image or appearance of the body, and they should develop a positive self-image. And also at this stage, we find that the substance abuse is seen because the adolescents feel that the new experience of consuming drugs can actually help them do new things. Of course, it's a new experience, but it comes in the way of the normal development. And we find that many factors may contribute for this substance abuse: the family environment, the violence that is experienced by the children from the parents, or the physical or emotional abuse or mental illness can cause this sort of drug use. There are also propensity or genetic vulnerability. The people who are somewhat genetically disposed for taking these drugs is seen, they have the higher impulse to take these drugs. Sometimes the children feel that they should have more sort of excitement, and mental health conditions like depression, anxiety, this can feel sometimes this taking of drugs can help them overcome such anxieties, and they feel that they have no knowledge, they feel sometimes it's cool to take drugs. But generally we know that this is because they are at a stage where the body is growing, the neuroplasticity is grown, the brain is growing. But at the same time, although the brain asks them to experiment new things, it is the prefrontal cortex, which is seen in the front part of the brain, which actually tries to help them to control their emotions. Therefore, the brain asks them to do, and these people involved in such a sort of experimentation, but they have no control. And the prefrontal cortex helps in the control of such emotions. And as it is in the growth phase, the prefrontal cortex has no role. And we find that the children have lack of judgment because of the growing stage. The adolescent brain is like a car where it is has fully functioning gas pedal, but it has weak brakes. That is, without prefrontal cortex, we find there is lack of adequate judgment and reasoning, and therefore, for immediate gratification or pleasure, the adolescents start taking the drugs. We find this will result in other complications, that is, unsafe sex or also other unsupervised activities. Also, it will result in school failures and normal healthy activities, impaired memories, and long-term consequences, and also susceptibility to diseases like HIV and hepatitis C, and also STD diseases, because most of the drug substance abuse is also involved in unsupervised sexual activity, which may actually result in lots of social, health, and psychological problems. We also find that there is a lack of IQ or loss of IQ. But generally it is seen there's less than 1/3 of the persons who are subjected to drug abuse have other mental health issues. Also, we find that most of the people having drug abuse are supposed to be well advised by their parents, or their parents should take them into confidence and try to provide them with some medical aid. We and continuous monitoring should be done. Sometimes relapses are seen, but we should not give up. At the same time, the adolescent should be provided with some sort of additional or different treatment. So it is the societal support which actually helps the adolescents to cross over this phase, but adequate monitoring and parental support and parental guidance at initial stages may itself see that they are not misused, or the drugs are not consumed by the adolescents. It is also necessary that the sexually transmitted diseases which occur due to the unwarranted sexual activity may actually result in certain diseases. The STDs, where the children are not guided properly with regard to the sexual activity, may result in several bacterial, viral infections. And if they are not immediately got hold of or treated, it is possible that they may lifelong persist and may harm the individual. The bacterial infections can be cured sometimes with antibiotics. Viral infections may sometimes cure or may not, and but they minimize the what we call the infection. And protozoan infections can be treated with medication. And transmission of STDs is due to sex activity or skin to skin contact. So sometimes we find the women with STD can also have infection, can carry on the infection to the fetus or pass them, which may result in some sort of ectopic pregnancies. Ectopic pregnancy is where the pregnancy is seen outside uterus. So the STDs are sometimes not seen, they're asymptomatic. There are also, the women are more prone to the STDs than men. And the age disparities, if we see that the children with the adolescents in the age of 15 to 24 account for half of all the new STDs. The social, economic, and behavioral aspects can all have a role. How a society treats, or how the economic conditions are of an individual are, and the behavioral conditions are seen. Depending on this, we find the STDs can be cured, and the norms with regard to sex and sexuality, if the people from a poor background is affected with STD, how he is treated societally, and his economic condition, and his what we call social perception of how he will be treated, and taking medical aid, all these will vary. And depending on these conditions, the adolescent health may either improve or deteriorate. So guidance, counseling, as well as medical aid and screening and treatment are all given proper importance during this period. So the adolescent should be actually guarded, as well as guided, as well as given medical aid and support during this period. They should be well informed about the causes and consequences of STDs. And if necessary, screening and treatment should be given. The other conditions are seen in the adolescents are depression, mood swings are seen, and sometimes these are related to the suicide also. So suicide is generally not because of depression. Depression conditions are seen where they have low self-attitude, low self-esteem, mood swings are seen, and it is also seen that they are they try to veer away from the society, and they try to veer away from the societal activities. And seeing the physical symptoms and changes in mood, we should see, the parents should guide them and try to take for medical support and aid. Sometimes we find that the juvenile delinquency is a condition where the persons from weaker economic backgrounds try to involve in societally disruptive behaviors. And these social delinquents are people who range, this delinquency ranges from minor offenses to major offenses. So this sort of juvenile delinquency can also be controlled by taking into consideration by their backgrounds and giving proper guidance and counseling from the community side, as well as the some governmental side. And here we also should see that the adolescents are given good guidance with regard to their careers. They should be set goals, and they should also give them supportive strategies to plan for their career development. And guided properly, the adolescent can actually grow for more developed, he can become a more developed person. So the parental support as well as the career support guidance from the society can have a bearing on the adolescence. So adolescence is generally a stage of flux where the physiological changes are there, and provided with proper guidance, it can result in healthy individuals and in healthy society. Thank you so much.